How's it going, guys? Cody guys back again, dropping yet another video. Right guys, I'd actually just finished this video about this story I've done. The phone dropped and by accident I knocked it off, so I'm fuming, so I've got to start again. I never get it first take, guys. In a lot of these vlogs I have to go over and over because I try to be a perfectionist, because if I misspell a word or mispronounce a word, I like to go back and do it again. Anyway, this time we're in the Guardian, guys, link in the description like I always do, you know that. Headline reads, "Poor healthcare in jails is killing inmates, says NHS watchdog." Almost half England's jails fail to provide adequate medical care to prisoners, says leaked briefing by the Care Quality Commission. The Care Quality Commission, guys, are the watchdog for the NHS. If you've got a loved one in prison and they're not getting the adequate mental health services or healthcare that's needed, always don't go to the governor. Don't pull a judicial review from the solicitor. Go straight to the CQC. Trust me. Almost half of England's jails are providing inadequate medical care to inmates whose health is being damaged by widespread failings, the NHS watchdog has told MPs in a scathing briefing leaked to The Observer. Healthcare behind bars is so poor in some prisons that offenders die because prison staff do not respond properly to medical emergencies, the Care Quality Commission says. Mental health services for 40% of inmates who have psychological or psychiatric problems are particularly weak, which contributes to self-harming and suicide amongst prisoners. According to the Care's regulators' confidential briefing to the Commons Health and Social Care Select Committee, that's a tongue twister and a half, isn't it? It blames chronic understaffing, problems getting to medical appointments and guards knowing too little about ill health to recognise problems. The mixture of NHS and private companies that provide healthcare in England's 113 adult jails and young offenders institutions frequently struggle to deliver safe and effective services, the Commission tells MPs. However, it adds, this is often due to issues outside of their control, such as shortages of prison and healthcare staff and environments of jail not offering suitable spaces for consultations. It adds, in 2017 to 2018, we completed 41 joint prison inspections with the Prisons Inspectorate. We found breaches of CQC, Care Quality Commission regulations, in 47% of these inspections and took corresponding regulatory action in some cases against more than one registered provider. The CQC ordered providers to take remedial action because the care offered to inmates was unacceptable in its quality or safety and breached the watchdog's 5 fundamental standards that requires providers to ensure services are safe, caring, effective, responsive and well led. That's 5 things you'll never hear in prison, guys. The document details a litany of problems, including mental health nurses unable to access, care for and treat prisoners because they are too busy responding to inmates having breakdowns or that have been given drugs. Shortages of prison guards to escort, that means prisoners are missing out on NHS appointments outside of the prison. Inspectors frequently find inadequate mental health awareness among prison staff and their inability to recognise mental health issues and seek appropriate support for prisoners. Incarceration can worsen prisoners' existing conditions or lead them to be developing new ones, such as limited exercise and exposure to sunlight, which causes a vitamin D deficiency, poor diet, illicit drug availability, assaults, injuries, exposure to communicable diseases, psychological deterioration, self-harm and suicide ideation. Follow-up inspections frequently reveal poor progress in achieving the intended improvements. The charity inquest said it was concerned about repeated failings by prison healthcare providers around communication, emergency responses, drugs and wider issues of mental health and healthcare provisions resulting in death. Evidence from our casework supporting families whose relatives have died in custody indicates that prisons are unhealthy and unsafe environments. A patient in prison has very little autonomy and control and access to medication and appointments. You've got to do apps and stuff, guys. Everything's hard work in jail. Prisons at their core are environments of toxic, high health risks, says Rebecca Roberts, its head of policy. In oral evidence to the committee in July, Peter Clark, the England's Chief Inspector of Prisons, painted a bleak picture of inmates' health and healthcare provision behind bars. Prisoners' mental health was suffering because of overcrowding, which means that many thousands do not have a cell to themselves, and cells must serve as the dining room, living room, kitchen and toilet. Also a bedroom as well. The illicit drugs trade in jail has led to a toxic mixture of violence, fear, debt and bullying for many prisoners. Clark added, as a result, they self-segregate and self-isolate. So they lock themselves off. They don't come out of the pads. They're not mixing with people. And instances of self-harm and suicide tragically flow from that. Inmates' inability to get to medical appointments due to staff shortages has produced an inevitable knock-on effect onto their health and well-being. Paul Williams, a Labour member of the Select Committee, which will publish a report into prisoners' health next week, said, "In too many prisons, a profoundly unhealthy environment and woefully inadequate staffing results in prisoners' health getting much, much worse. Because of their time inside, missed appointments lead to missed cancers, and severely mentally ill prisoners are kept in cells instead of hospital wards." Professor Stephen Field, the CQC's Chief Inspector of Primary Medical Services or Integrated Care, added, "During our programme of inspections, partnerships with Her Majesty's Inspector of Prisons, we found some poor care and of serious concerns that issues have found are affecting the health of some of the most vulnerable people in society." That is prisoners, guys. Some of the most susceptible and most vulnerable members of society. "I'm anxious that the issues highlighted in our evidence surrounds mental health provisions, staff training, particularly nurse-doctor training, and inadequate pharmacists' oversights of prescribing are dealt with as a matter of urgency. A government spokesman said we are investing tens of millions of pounds in prison safety and decency." Oh God, here we go. "We are spending an extra 40 million to improve security and tackle the drugs that we know are fueling the violence and healthcare problems, including X-ray scanners, drug detection dogs. Over 3,500 officers, new prison officers have been recruited in the last 2 years, which will help improve access to healthcare services." Now, that's just a generic thing that they throw out, and all they've done is had about healthcare. It's rubbish, guys, right? Absolute rubbish, right? Simple fact, right? I've got to be careful because one of my subscribers works in healthcare in a prison somewhere in England. That's one of my subscribers. Never reveal your sources and stuff. But yeah, like I say, nurses that mental health services in prison, guys, first things first, are off the scale. And the shocking, guys, like I say, and it's very true. A lot of the statements in that story, I can't actually disagree with. Like I say, everything's pretty much bang on the money. You know what I mean? It really, really is. It's a bleak picture, guys, of what's going on within prisons. Mental health services are short. Nurses that should be dealing with certain prisoners are dealing with other prisoners because they've overdosed on spice, or they're off the nut, or like it says, they're having a nervous breakdown or a mental health episode or a psychotic episode. And other prisoners that are self-harming, they can't be everywhere, guys, and there's not enough of them for what's going on all the different wings within the prisons. But the fact is, guys, like I say, it's shocking, and it directly contributes to self-harm and suicides in prison, which is shocking. Right? You've only got to look at my recent vlogs to see how many. There's been 3 suicides in 4 weeks at HMP Liverpool or Walton Jail. There's been Nottingham. You had Joshua Sholuk. Do you know what I mean? There's this up in the northeast. There's been so many deaths, guys, in custody, and it stems from mental health. Prison. If you haven't already got mental health issues when you go to prison, being locked up behind your door for long periods, and what prison actually does to you, and the psychological effect it actually takes on you, physically, emotionally, and mentally, it contributes to self-harm and stuff like that. And if you haven't already got mental health issues, it starts them. I genuinely do believe that. I stick by that, guys. Like I say, if you've got a loved one in prison and you're not happy with the healthcare they're receiving, don't start writing to the jail and ringing the government and kicking off and ringing solicitor and getting judicial reviews. Go straight to the CQC. Tell the CQC, go to the CQC, the Care Quality Commission. They are above the NHS and they watch over them. Like I say, there's a lot of good nurses within prisons and stuff like that, but the facts are there's not enough of them. They are underfunded. Do you know what I mean? The daily routine it's taking them off the wings when they've got to deal with these prisoners that are ODing and stuff like that, and suicide attempts and self-harm and stuff like that, and they're giving medication out, and oh, do you know what I mean? When new prisoners come in on a night, then they get checked the next morning, do blood pressure, check them over, blah, blah, blah. There's a lot that they do, guys, and there's not enough hours in the day, the truth be told, and they are stretched and stuff like that, but at the end of the day, it's resulting in prisoners leaving prisons in body bags or self-harming, do you know what I mean? Shocking reading that story. I'll put a link in the description below like I always do. Let me know what you think about the story. Are you shocked? I'm not shocked, particularly as a former prisoner. Let me know what you think. Like, comment, subscribe. Cody out.